Welcome to another deep dive. This one's on a topic that seems to be getting a lot of attention in healthcare these days.
Yeah, you're definitely right about that.
Complementary and integrative health approaches.
You're seeing those terms.
CHAs and IH for short.
CHAs and IH pop up more and more.
You're probably seeing them all over your nursing studies.
And for good reason.
And there's a good reason for that. It's not just a trend, you know?
Right.
It's really a reflection of, I think, how healthcare is evolving and how patients are taking a more active role in their own well-being.
Absolutely.
So we've got a ton of research here.
Yeah.
And all kinds of excerpts that you've pulled from different places. But
Yeah.
before we dive into all that,
Yeah.
can we just start with the basics? Like, what exactly are complementary and integrative health approaches? I feel like those terms get tossed around a lot, but
Yeah.
what do they actually mean in a practical sense?
That's a great place to start. We should clear up any confusion. Complementary health approaches,
Yeah.
those CHAs. Uh-huh.
Are things that people use alongside conventional medical treatments.
Okay.
So think about a patient who's undergoing chemotherapy.
Okay.
They're following their oncologist's recommendations, but they're also using meditation to help manage the stress and anxiety related to their treatment.
Right.
That's a complementary approach.
So it's like adding another tool to the toolbox.
Exactly.
Not throwing out the whole toolbox altogether.
Exactly. It's about giving patients more options and empowering them to participate in their own healing process.
Right.
Now, integrative health, that's IH,
Okay.
that takes this idea a step further.
Okay.
It's about intentionally blending conventional medicine and complementary approaches in a coordinated way.
Okay.
It's not just adding on, it's about creating a truly personalized plan that considers the whole person, their physical, emotional, and even spiritual needs.
So with complementary approaches, you're adding something to conventional medicine.
Yes,
But with integrative health, you're weaving it all together into one cohesive approach.
exactly.
And this idea of a cohesive approach really stems from the concept of holism,
Okay.
which is a core principle underlying both CHAs and IH.
Holism. Now, that's a term I've come across, but honestly, I could use a refresher.
Of course.
It sounds a bit philosophical. How does it actually relate to healthcare, especially for us as nurses?
Great question. Holism is about seeing the person as a whole.
Okay.
Mind, body, spirit, all interconnected.
Okay.
It's a shift away from just focusing on the disease or the symptom, and instead considering all of the factors that contribute to a person's well-being.
So it's not just about treating what's broken.
Right.
It's about looking at the whole system.
Think about it this way. If you only fix one part of a car engine in isolation, ignoring the rest of the system, will the car actually run smoothly? Probably not.
That's a really helpful analogy.
Yeah.
It makes holism a lot less abstract and a lot more practical.
Exactly.
So how does this holistic perspective actually play out in healthcare?
Well, let's take the World Health Organization's definition of health as an example. They define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. You see holism woven right into that definition. It's not just about being disease-free, it's about thriving in all aspects of your being.
It really challenges the traditional fix-it model of medicine. It makes me think differently about how I, as a future nurse,
Yeah,
can approach patient care.
for sure.
It's about supporting their overall well-being,
Absolutely.
not just treating their immediate symptoms.
Exactly. And this brings us to the rise of integrative care,
Okay.
that you're seeing more and more of these days.
Yeah.
It's about combining the best of both worlds, conventional medicine and complementary approaches.
So it's like taking that holistic perspective and turning it into an actual healthcare approach.
Exactly.
Okay. Can you give us like a real-world example of how this might look for a patient?
Absolutely. Imagine a patient who's dealing with chronic sinus congestion. They might be prescribed a decongestant by their doctor, which is a conventional approach,
Right.
but they also might choose to incorporate acupuncture to help alleviate the congestion and address any underlying imbalances.
Okay.
That's a simple example of integrative care in action.
So you're not replacing the conventional treatment.
Yeah.
You're working with it,
Exactly.
which is a really important point.
Yes. It's all about working collaboratively with the patient and the healthcare team to develop the best possible plan for that individual.
So we've talked about holism.
Right?
We've talked about complementary approaches
Yes.
and integrative care.
Yeah.
What are some of the specific mind-body practices that are often included in this realm? I feel like those are getting a lot of attention these days.
They are, and for good reason.
Yeah.
Mind-body practices recognize the powerful connection between our thoughts, emotions, and physical health.
Right.
Things like yoga, tai chi, and meditation all fall under this umbrella.
I can see how those would fit in.
Yeah.
But how do they actually work? Is it just about relaxation, or is there something more going on?
It's definitely more than just relaxation, although that's a great benefit in itself.
Right.
The field of psychoneuroimmunology,
Yeah.
or PNI, has actually shed light on how our mental and emotional states can directly influence our immune system and overall health.
PNI.
Oh,
Can you break that down for us?
of course.
Like, what does that mean?
PNI is the study of how our nervous system, endocrine system, and immune system are all interconnected and constantly influencing each other.
Okay.
Essentially, it shows us that what's going on in our minds can have a very real impact on our bodies.
So it's like our minds and bodies are constantly in communication.
Exactly.
And this communication can either help or hinder our health.
Precisely. Think about how your heart races when you're anxious, or how your stomach churns before a big presentation. Those are clear examples of how our thoughts and emotions trigger physical reactions in our bodies.
I can definitely relate to that. It makes you realize how powerful our thoughts can be
Yeah.
and how important it is to address the mental and emotional aspects of health,
Absolutely.
not just the physical symptoms.
For sure. And we're back diving deeper into the world of complementary and integrative health approaches.
It's been eye-opening, honestly, seeing how these approaches can actually fit into a patient's overall care plan.
Yeah.
It's really exciting. But I know we've only scratched the surface.
Right.
What else is out there that nursing students should be aware of?
There's so much to explore. We were just talking about mind-body practices.
Right.
But what about those therapies that focus on the body's energy fields?
Okay.
They often get lumped into that, alternative category.
Right.
But they're becoming more mainstream all the time.
Energy healing. Okay. I'll be honest. That's one area where I'm a bit skeptical. It sounds a little too out there for me.
Sure.
Can you help me understand it from a more grounded perspective?
Absolutely. I get it. It can seem a bit mystical at first. Yeah.
But the basic premise is that we all have a subtle energy field or life force.
Okay.
You might hear it called ki in Chinese medicine,
Right.
or prana in Ayurvedic traditions.
Okay.
And the idea is that when this energy field is blocked or out of balance, it can contribute to illness.
So energy healing is about restoring balance to this energy field.
Exactly.
But how do practitioners actually do that? It all sounds a bit like magic.
It's not about magic wands or spells, that's for sure. Practitioners use a variety of techniques,
Right.
often involving gentle touch,
Okay.
or working with the energy field just above the body.
Okay, so walk me through it. What's an example of an energy healing technique that a patient might be using?
One common modality is therapeutic touch,
Okay.
often called TT for short.
Okay.
Practitioners who use TT will assess the patient's energy field with their hands
Okay.
and then use specific movements to clear any perceived blockages and promote balance.
Okay.
It's a very gentle and non-invasive approach. Interesting. So it's not about transferring energy from the practitioner to the patient,
Right.
like I sometimes hear about.
Yeah,
It's more about working with the patient's own energy field.
that's right. TT is about facilitating the body's natural healing abilities by restoring energetic balance. Now, there are other energy healing modalities like Reiki where the practitioner does act as a conduit for energy.
Right.
But even then, it's about working in harmony with the patient's energy system, not overriding it.
This is helping me understand it better, honestly.
Yeah,
It's still a bit outside my comfort zone,
sure.
but at least I'm starting to see the logic behind it.
And that's the key, right? To approach these modalities with an open mind and a willingness to learn.
Yeah.
Now, speaking of things that can be a bit controversial,
Okay.
we have to talk about natural products.
Okay.
Herbs, supplements.
Yeah.
They're everywhere these days, and patients are bound to ask you about them.
Oh, absolutely. It seems like everyone is trying some new herbal remedy or supplement.
Right.
But how do we, as nurses, navigate this landscape? There's so much information out there,
There is.
and not all of it is reliable.
You're right. It can be a minefield. And it's where our critical thinking skills really come into play.
Okay.
We need to be able to educate our patients
Uh-huh.
and help them make informed decisions about natural products.
So what are some key points to keep in mind when talking to patients about herbs and supplements?
First and foremost, just because something is labeled natural
Right.
doesn't mean it's safe or effective.
Okay.
Herbs and supplements can have potent effects,
Right.
interact with medications, and even be harmful in certain situations.
That's so important to remember. I think sometimes people have this idea that if it comes from nature,
Right.
it must be harmless.
That's a common misconception, and it's one we need to address.
Right.
We also need to emphasize that natural doesn't necessarily mean better.
Right.
Sometimes conventional medications are the most appropriate and effective treatment.
Okay. So we need to be cautious and promote critical thinking. What else should we be considering when patients ask about these products?
It's crucial to gather a thorough medication history,
Okay.
including any herbs or supplements they're already taking.
Right.
We need to be aware of potential interactions, allergies, and contraindications.
Right. We don't want to be causing more harm than good.
Exactly. And we should always encourage open communication between the patient, their doctor, and any other healthcare providers involved in their care.
Yeah.
Everyone needs to be on the same page regarding the use of natural products.
That makes sense. It's all about teamwork and shared decision-making.
Absolutely. Now let's switch gears and talk about a topic that's been making headlines and generating a lot of interest in healthcare: medical cannabis.
Okay, this is one I'm particularly curious about. There's so much information and misinformation circulating about cannabis.
Right.
And patients are definitely asking about it.
You're not alone.
Yeah.
It's a rapidly evolving area, and it's crucial for nurses to stay informed.
So let's start with the basics. What is medical cannabis exactly?
Medical cannabis refers to the use of the cannabis plant or its extracts for medicinal purposes. And within the cannabis plant, you have over 100 different chemical compounds called cannabinoids.
Okay, cannabinoids, I've heard that term,
Yeah,
but I need a little more explanation.
sure. The two most well-known cannabinoids are THC and CBD.
Okay.
THC is the compound that's primarily responsible for the psychoactive effects of cannabis, the high that people associate with marijuana.
So THC is the one that can alter perception and mood.
Exactly. CBD, on the other hand, is non-psychoactive.
Okay.
It doesn't produce that high.
Right.
And it's often touted for its potential therapeutic benefits.
So THC is the one that gets you high, and CBD is the one that might have medical benefits.
That's a simplified way of putting it, but yes.
Okay.
It's important to note that both THC and CBD interact with the body's endocannabinoid system,
Okay.
which is involved in a wide range of functions, including mood, sleep pain, and immune response.
Wow, our bodies have a whole system dedicated to interacting with cannabis compounds.
That's right. And this system plays a crucial role in maintaining balance and homeostasis within the body.
Okay, so THC and CBD both interact with this endocannabinoid system,
Yeah.
but in different ways.
Exactly. They bind to different receptors and produce different effects.
Okay.
THC primarily binds to receptors in the brain, explaining its psychoactive properties. CBD, on the other hand, interacts with receptors throughout the body.
So it's not as simple as saying THC is bad and CBD is good.
Right.
It sounds like they both have their own unique properties and potential applications.
Precisely. And that's why it's so important to have a nuanced understanding of these compounds and how they work in the body.
Makes sense. Now let's talk about the medical applications. What kinds of conditions are being treated with medical cannabis?
There's a growing body of research exploring the potential benefits of cannabis and cannabinoids for a wide range of conditions: chronic pain, multiple sclerosis, nausea, and vomiting related to chemotherapy, certain types of epilepsy. The list goes on.
So there's definitely some legitimate medical use for these substances,
Yes.
but what about the risks?
That's a crucial question. Like any medication, cannabis can have side effects, and these can vary depending on the individual, the dose, the method of administration, and the specific cannabinoid profile.
Can you give us some examples of potential side effects?
Sure, with THC, you might see things like dizziness, dry mouth, increased heart rate, impaired coordination anxiety, or even paranoia in some people. CBD generally has a milder side effect profile,
Okay.
but it can still cause fatigue, diarrhea, and changes in appetite.
So not exactly harmless.
Right.
And I imagine there's a risk of addiction too, especially with THC.
That's right, especially with products that contain high levels of THC. And there's also the issue of potential interactions with other medications, which is why it's so important for patients to talk to their healthcare provider
Right.
before using any cannabis products.
Fair point. It's not something to just experiment with on your own.
Absolutely.
Yeah.
And let's not forget the legal considerations.
Right. The legal landscape around cannabis is constantly changing, and it varies from state to state.
It does.
It's a lot to keep up with.
It is. And that's why staying informed and educated is so important.
Right.
We need to be aware of the laws in our state, how they apply to our practice,
Man.
and be prepared to answer patients' questions accurately and responsibly.
It sounds like there's a lot of responsibility on our shoulders as nurses when it comes to medical cannabis.
There is. But it's also an incredible opportunity to be at the forefront of this evolving field, helping patients navigate the complexities and make informed decisions about their health.
It's definitely a lot to consider, but I'm starting to feel more confident about approaching this topic.
That's great to hear. And remember, you don't have to have all the answers.
Right.
It's about being a resource for your patients, listening to their concerns, and helping them find accurate information.
Okay, so we've talked about mind-body practices.
Right.
We talked about energy healing,
Yes.
natural products,
Yeah.
and now medical cannabis.
Mhm.
Are there any other big categories of complementary and integrative health approaches that we should be familiar with?
There are. And these are the ones that are often referred to as whole systems of medicine.
Okay.
They're not just individual therapies.
Right.
They're complete systems of health and healing with their own unique philosophies, practices, and traditions.
Ooh, whole systems of medicine. That sounds intriguing. Can you give us some examples?
Absolutely. One of the most well-known is Ayurveda, which originated in India over 3,000 years ago.
3,000 years. That's incredible. What are the fundamental principles of Ayurveda?
Ayurveda is all about achieving balance and harmony
Okay.
within the body, mind, and spirit.
Okay.
And it recognizes that each individual is unique
Right.
with a specific constitution that influences their health and well-being.
Okay, so it's a very personalized approach.
It is.
What determines an individual's constitution in Ayurveda?
In Ayurveda, it's called your dosha.
Dosha.
And it's a combination of different energies or life forces.
Right.
There are three main doshas, Vata, Pitta, and Kapha.
Okay.
Vata is associated with movement and air, Pitta with fire and transformation, and Kapha with stability and earth.
3 different energies. I'm intrigued.
Yeah.
But I'm going to need a little more explanation. What do these doshas actually mean in a practical sense?
Think of it this way. Each dosha governs certain physical and mental characteristics.
Okay.
We all have a unique combination of these doshas. When they're in balance, we experience health and vitality.
Okay.
But when they're out of balance,
Yeah.
we're more susceptible to disease.
Okay, I see. So Ayurveda is about understanding your individual dosha and making lifestyle choices that support balance.
Exactly. And those lifestyle choices can include things like diet, exercise, yoga, meditation, and even herbal remedies. It's a holistic approach that focuses on preventing disease and promoting well-being rather than just treating symptoms.
I'm starting to see how these ancient systems of medicine are really relevant to modern healthcare,
Yeah.
especially with the growing emphasis on personalized medicine and preventative care.
Absolutely.
Are there other whole systems of medicine that we should be aware of?
There are. Another one that's gaining recognition in the West is traditional Chinese medicine, or TCM.
I've definitely heard of TCM. It involves acupuncture.
It does. Acupuncture is one of the key practices in TCM, but it's just one piece of the puzzle. Like Ayurveda TCM is based on the idea of achieving balance and harmony,
Right.
but it uses a different framework.
Okay, tell me more. What's the framework in TCM?
TCM is based on the concept of qi,
Yeah.
which is often translated as vital energy.
Okay.
Qi flows through the body along specific pathways called meridians.
Okay.
And TCM practitioners believe that illness arises when the flow of qi is blocked or imbalanced.
So acupuncture helps to restore the flow of qi.
That's one way to think about it.
Okay.
Acupuncture needles are inserted into specific points along the meridians to stimulate the flow of qi and restore balance.
It sounds like a very precise system.
It is, and it's a system that's been refined over thousands of years of practice and observation.
Besides acupuncture, what other practices are part of TCM?
TCM also includes things like herbal medicine, massage, dietary therapy, and mind-body practices like Tai Chi and Qigong.
Okay.
It's a truly holistic system that addresses all aspects of a person's well-being.
It sounds like there's a lot of overlap with some of the other approaches we've discussed,
There is.
like Ayurveda
Yes,
and even mind-body practice.
for sure. And I think that speaks to the interconnectedness of these different modalities. They might have different origins and frameworks,
Right?
but they all share a common goal of promoting balance and harmony within the body.
That's a great point. So we've got Ayurveda and TCM, both ancient systems of medicine that are still relevant today.
Yes.
Are there any other whole systems that we should be aware of?
There are. We could talk about homeopathy, naturopathy, and many others.
Wow.
But for now, let's shift our focus back to energy healing
Okay.
and explore some additional modalities that patients might be using.
Okay, energy healing, we talked about therapeutic touch earlier,
Right.
but I know there are other approaches out there.
There are.
What else should we be familiar with?
One that's gaining popularity is Reiki, which originated in Japan.
Reiki, okay.
It's similar to therapeutic touch in that it involves working with the body's energy field.
Uh-huh.
But in Reiki, the practitioner acts as a conduit for universal life energy,
Okay.
rather than actively manipulating the energy field.
So it's like they're channeling energy into the patient.
That's right. Reiki practitioners believe that they can channel this energy to promote healing and well-being.
Interesting. It sounds like a very gentle and passive approach.
It is, and it can be very relaxing and restorative for patients.
So we have therapeutic touch, which is about balancing the energy field.
Right.
And Reiki, which is about channeling energy.
Yes.
Are there other energy healing modalities that use different techniques?
There are many. Some modalities combine aspects of TT and Reiki. Others, like healing touch,
Okay.
incorporate a variety of techniques, including energy-based assessments, clearing and balancing.
So many different approaches. It seems like there's a whole world of energy healing out there.
There is, and it's a world that's becoming more and more accessible to patients.
Yeah.
As nurses, it's important to be aware of these modalities, even if we don't practice them ourselves.
Right.
We need to be able to answer patients' questions and provide guidance on finding qualified practitioners.
That makes sense. But I'm also curious about the scientific evidence behind energy healing.
Sure.
Is there any research to support the claims made about these therapies?
That's a great question, and it's one that researchers are still exploring. It's a challenging area to study scientifically because subtle energy is, by its very nature, difficult to measure and quantify.
That makes sense. It's not like we can see energy fields on an X-ray or measure chi levels with a blood test.
Exactly. But that doesn't mean that energy healing doesn't have real effects. Some studies are looking at the physiological effects of energy healing, such as changes in heart rate, blood pressure, brainwave activity, and even pain levels.
So they're trying to measure the impact of energy healing on the physical body.
That's right. And some studies have shown promising results, suggesting that energy healing can have measurable effects on the body. But more research is needed to fully understand how these therapies work and for whom they're most effective.
It sounds like there's a lot we still don't know about energy healing, but there's also a growing body of evidence suggesting that it's more than just placebo effect.
Exactly. And I think it's important for us as nurses to be open to new possibilities and be willing to consider different perspectives on healing.
Absolutely. Especially when it comes to something as complex and multifaceted as human health.
Well said. Now let's move on to another intriguing complementary approach that's gaining traction in healthcare. Aromatherapy.
Aromatherapy. Now, this is one I can get behind. I love the smell of essential oils.
Yeah,
But is there any real therapeutic value to them?
there is. Aromatherapy is the use of essential oils,
Okay.
which are highly concentrated extracts from plants to promote physical and emotional well-being. These oils contain powerful chemical compounds that can interact with our bodies in a variety of ways.
So it's more than just making things smell nice.
Much more. When inhaled, essential oils can stimulate the olfactory receptors in our nose, which send signals to the limbic system in our brain, which is the area that's involved in emotions, memory, and even our hormonal system.
So aromatherapy can directly impact our mood,
Yes.
stress levels, and even our physical health.
Exactly. And there's a growing body of research exploring the specific effects of different essential oils.
Okay.
For example, lavender oil is often used to promote relaxation and improve sleep quality.
That makes sense. I always feel calmer when I diffuse lavender oil before bed.
And peppermint oil is often used to relieve nausea and headaches. Tea tree oil has antimicrobial properties and can be helpful for skin conditions.
Wow. Essential oils are a versatile tool. It sounds like there's an oil for just about everything, but are they safe for everyone to use?
That's a great question. Essential oils are very potent,
Right.
and it's crucial to use them with caution. Some oils can cause skin irritation if used undiluted, and some oils should be avoided during pregnancy or in young children.
So just like with herbs and supplements,
Yes.
we need to be promoting safe and responsible use of essential oils.
Absolutely. And it's important to choose high-quality oils from reputable sources.
Right.
There's a lot of variation in purity and potency.
Okay, so what about us as nurses?
Yeah.
Can we integrate aromatherapy into our practice?
Absolutely. Aromatherapy can be used to create a calming and therapeutic environment for patients.
Like using lavender oil to help a patient relax before a procedure or peppermint oil to ease nausea after surgery.
Exactly. But it's important to remember that we're not aromatherapists.
Right.
And we should always consult with a qualified practitioner before using essential oils therapeutically.
Good point. It all goes back to interprofessional collaboration.
Yes.
And working together as a team to provide the best possible care for our patients.
Precisely. And speaking of teamwork,
Yeah.
we need to address another crucial aspect of providing culturally sensitive care,
There you go.
especially when it comes to complementary and integrative health approaches.
Cultural sensitivity. That's something that's been woven throughout this entire conversation.
It has.
But why is it so important in this context?
Well, we need to remember that our patients come from diverse backgrounds
Right.
with their own unique beliefs and practices
Uh-huh.
about health and healing.
Right.
And what might be considered beneficial or acceptable in one culture might be viewed very differently in another.
So when we're talking to patients about CHAs, we need to be sensitive to their cultural background and avoid making assumptions.
Exactly. We need to ask open-ended questions,
Mm-hmm.
listen attentively, and try to understand their perspective.
Right.
For example, some cultures have long-standing traditions of using herbal remedies, energy healing, or other practices that might be unfamiliar to us.
It's about approaching each patient with curiosity and respect,
Yes.
recognizing that their cultural background plays a significant role in shaping their healthcare choices.
Well said. It's about honoring the whole person, not just their symptoms, and creating a care plan that's truly individualized and culturally sensitive.
This deep dive has really highlighted the importance of cultural humility in nursing.
It has.
It's about recognizing that we don't have all the answers.
Right.
And that we can learn so much from our patients.
I couldn't agree more. It's about being open to different perspectives, willing to step outside our comfort zones, and embracing the richness and diversity of human experience.
This has been such an eye-opening conversation. I'm feeling much more confident about approaching complementary and integrative health approaches with my patients.
That's fantastic to hear. And remember, this is just the beginning. There's so much to explore in this field, and it's constantly evolving.
We're back for the final part of our deep dive into this world of complementary and integrative health approaches. And it's been quite a journey.
It really has.
We've covered so much ground, from the philosophy of holism to the practical applications of different therapies. I feel like...
Yeah, it's been a whirlwind tour for sure.
Yeah.
We've explored the science, the culture, and the ever-evolving landscape of CHAs and IH.
Yeah, and I'm definitely feeling a lot more
Good.
knowledgeable and a lot more comfortable with these concepts.
That's great to hear.
But I have to admit,
Sure.
there's still a part of me that's wondering, like,
Yeah.
okay, I get it, but
Yeah.
how do I actually apply all of this?
Right.
You know,
Of course.
in real-life nursing situations, it feels like
Yeah.
one thing to understand the theory,
Right.
but another thing entirely to put it into practice.
That's a perfect segue into what I wanted to discuss in this last part of our deep dive,
Okay.
the practical application
Yeah, let's talk practical application.
of CHAs and IH in nursing. It's where the rubber meets the road.
Where do we even begin?
It all starts with assessment, just like with any other aspect of nursing care.
Okay.
We need to assess our patients' beliefs, values, and preferences regarding complementary and integrative health approaches.
So asking questions like,
Yeah.
have you ever tried any complementary therapies?
Exactly.
Or what are your thoughts on using natural products alongside conventional medicine?
Precisely. Those open-ended questions can open up a world of understanding and help us to create those personalized care plans.
Right.
And remember, it's not just about asking the questions.
Yeah.
It's about actively listening to the answers without judgment.
Active listening. That's such a fundamental nursing skill,
Yeah.
but it's especially important here, isn't it?
It is.
We need to create a safe space
Yes.
for patients to share their experiences and their beliefs,
Absolutely.
even if those beliefs are different from our own.
Our patients are the experts on their own bodies and their own experiences. We need to honor that and approach each conversation with curiosity and a willingness to learn.
Okay, so we assess, we listen, we respect. What's the next step?
It's about providing evidence-based information and guidance. We need to be a reliable resource for our patients, helping them understand the potential benefits and risks of different approaches, the scientific evidence or lack thereof behind them, and any legal considerations.
So, for example, if a patient's interested in trying acupuncture for chronic pain,
Yeah.
we can provide them with information on how acupuncture works,
Exactly.
the potential side effects, where to find a qualified practitioner.
Yeah, we can also help them to have those conversations with their doctors
Right.
about how complementary therapies might fit into their overall care plan. Again, it's about empowering patients to make informed decisions, not dictating what they should or shouldn't do.
This all highlights the importance of communication and collaboration.
He does.
We're not working in isolation. We're part of a team.
You're so right. Effective communication with the patient their doctor and any other healthcare providers involved is essential.
Yeah.
And we need to be comfortable advocating for our patients, especially when it comes to CHAs.
Advocating, that's a big part of our role as nurses, but it can feel a little daunting sometimes,
Right.
especially when we're dealing with approaches that might be unfamiliar or controversial.
I understand. But remember, advocating doesn't mean pushing our own beliefs on patients. It means supporting their right to make informed choices and ensuring that their voices are heard.
So it's about being a partner in their healthcare journey,
Yes,
not a dictator.
exactly. And part of being a good partner is educating our patients so they can make those informed choices.
Like,
We can empower them by providing reliable resources and helping them develop critical thinking skills.
so teaching them how to evaluate information they find online,
Exactly.
how to spot red flags for potentially harmful products or practices, and how to advocate for their own healthcare needs.
You got it. It's about giving them the tools to be active participants in their healing process.
And, our role as nurses extends beyond the hospital or the clinic.
It does.
We're in a position to promote health and well-being in all aspects of our patients' lives.
That's such an important point. We can encourage those healthy lifestyle choices that align with complementary and integrative health principles,
Right.
like stress management techniques, mindful movement practices, and a balanced approach to nutrition.
It's inspiring to think about the ripple effect we can create,
is.
not just on individual patients,
Right.
but on the broader culture of healthcare.
Absolutely. As complementary and integrative health approaches continue to gain momentum, nurses will be at the forefront of this shift, shaping a future where healthcare is truly holistic, patient-centered, and empowering.
And that's really the essence of what we've been exploring in this deep dive, right?
It is.
It's not just about specific therapies or techniques.
Right.
It's about a shift in perspective,
Yes.
a recognition of the
Very.
interconnectedness
Absolutely.
of mind, body, and spirit,
Yes.
and a commitment to providing truly personalized and compassionate care.
Beautifully said. It's about honoring the whole person and recognizing that inherent healing capacity within each of us.
So as future nurses, you have the opportunity to be agents of change,
You do.
to integrate these principles into your practice, and to make a real difference in the lives of your patients.
Remember, it's a journey of continuous learning and growth. Stay curious, stay engaged, and never stop exploring this vast and fascinating world of complementary and integrative health approaches.
Well, this has been fantastic. We've covered a lot of ground, we've explored a lot of ideas, and hopefully sparked some inspiration along the way.
It has been a pleasure diving deep with you.
And thank you for sharing your expertise and your insights with us. And to all of you listening out there, keep those questions coming, keep learning, and keep advocating for your patients and for the future of healthcare.